This interview with long COVID kids was recorded on the 11th of March 2022.
Hello everyone and welcome to this edition of Alliance Live. I'm Hannah Tweed, Senior Policy Officer at the Health and Social Care Alliance Scotland, and in this episode I'm very grateful to be joined by Helen Goss from Long COVID Kids. Long COVID Kids is or possibly the, correct me if I'm wrong Helen, charity representing children and young people and their families who are living with long COVID. And Helen's the Long COVID representative, the Long COVID Scotland representative. Long COVID Kids representative for Scotland. Got there eventually. So hello, Helen, and thanks very much for taking the time to speak to me today.
Hi, Hannah. Thank you. Yes, you're absolutely right. We are at the moment, as far as we know, the only charity in the world actually supporting families who have children and young people living with long COVID. So yeah, at the moment we are filling that gap. We have resources that we have developed ourselves alongside healthcare professionals to help the families understand what their children are going through, and then help the wider community understand what their children are going through. Because at the moment, unfortunately, there is still this gap in understanding, a gap in knowledge about what long COVID is in children, what it looks like, and how it affects each child. And each child, again, is affected differently. So, you know, long COVID is an umbrella term. There are a lot of symptoms similar to adults, but long COVID in children looks slightly different. For example, my daughter, she has really quite severe cognitive dysfunction. she has neuropsychiatric symptoms and extreme fatigue, which is not quite along the ME/CFS line, but she is extremely debilitated. Whereas other children in the group have more of a MCAS and POTS situation with rashes and things like that. So each family is different, each child is experiencing long COVID differently, and trying to support that, it is challenging, but at the moment we are the only support there is at the moment in Scotland, in the absence of any long COVID services.
Yeah, which is a significant group of people to be supporting. Significant in both terms, senses of the word. But yeah, just for clarification for any audience members who aren't familiar with the term, POTS, postural tachycardia. Or could you give a brief gloss of that, just for folk?
Yeah, POTS.
What does it mean in practice?
Postural orthostatic tachycardia syndrome. Oh God, if I've got that wrong, that would be embarrassing. POTS is essentially, I mean, for example, if you get up really quickly, you'll get very, very dizzy. Some children faint a lot. So there's a lot of dizziness, a lot of irregular heart rate. There's a lot of headaches and nausea with POTS. Adults are getting POTS as well, so there's a similarity there. It's treatable with medication, and some families are struggling to access that for their children. So this is the sort of thing where we can signpost to POTS charities as well, where they can get really quite specific information to help them to take to their healthcare professionals. The other syndromes, I don't know if you want me to go through those, PANS, which is what my daughter has, Pediatric, Acute, Onset Neuropsychiatric Syndrome. Essentially, it's an autoimmune condition. The brain has been inflamed and it causes psychiatric symptoms. Very, very difficult to manage. I can't even go into explaining how hard PANS is to manage, because honestly it's been quite traumatic experience. But again, children who are presenting with PANS-like symptoms, we can signpost them to the PANS Pandas charity, who are experts in what they do. MCAS as well, you know, the histamine responses, that's really common in children with long COVID, so we can then signpost to specialists in that. You know, so it's very much a collaborative effort. Everything comes, they come to us because families come to us because their children are not recovering after COVID infection. They don't know why they're not recovering from COVID infection. The symptoms can be severe, disabling, chronic. It's not a benign condition at all. And then when they come to us, they really are desperate. They don't know where to go. They don't know who can help them. So that is our role. We try to signpost to where they can get help. We have information ourselves to help them, and we offer peer support, which honestly has been absolutely life-saving for myself. And we know from testimonials from the over 10,000 families now in our support group, that if we didn't have the support group, goodness me, we don't know where we'd be, quite honestly. It's so valuable to have that understanding and validation, and you don't have to explain yourself. People just know what you're going through, understand what you're going through, and can offer any tips or advice that have helped them that you can go and try and see if it works for you and your child. So that was a long-winded way to explain what POTS was.
No, but I think it's really useful in both in illustrating what you just referenced in terms of the relief of not having to explain, if I can put it in those terms, but also in terms of, I think sometimes I hear discourse around long COVID and we don't know, and actually to be able to say, well, we don't know about X, Y, or Z, But what we can do is signpost for these specific symptomatic supports. And the peer support. I think it is really important to keep that front and center as well, if that makes sense. So I think that's a really useful unpacking.
And it can be really, honestly, soul destroying when you take your child to the GP or pediatrician or physiotherapist, and they say, well, we're not really sure how we can help. And yes, we are still learning about long COVID and the mechanisms behind it. We don't understand it fully yet. The research is still catching up with the lived experience. But there are things that we can do to help and to make life easier and to give children and young people more of a quality of life. And so that's our aim, is to try and make this easier for families, and just support them in any way that we can. Honestly, it's difficult situation for the families.
Absolutely. And I guess one of the things I know we've talked out with this interview is the ways in which long COVID, the impacts of that for children and young people are distinct perhaps from adults. And one of the particular topics there is education. And I know in Scotland we've got a range of work on children's rights, including most recently the incorporation of the UN Convention of the Rights of the Child. And I'm thinking particularly of Articles 23 and 28. So those are the ones, forgive me if I paraphrase this incorrectly, around a child with a disability having the right to live a full, decent life with dignity and, as far as possible, independence, and to play an active part in their community. And also, every child has a right to an education. And I'm thinking about those two statements and where that sits with on COVID. So what do you see as the key things that need to happen to make sure that children and young people are able to access their rights and are not excluded by long COVID?
Yeah, this is really quite a tragic point, is that at the moment we are not getting it right for every child. I can, from our personal experience right now, Anna's not receiving any formal education at all. I've requested she's too poorly to get into the school building. We've tried. She is too unwell and does not manage with doing online school. Again, we have tried so many times, different methods and all kinds of things. So I've requested home tuition from the local authority. They haven't said no, but they haven't said yes. And this is a problem that we're seeing in our group, is that there is at the moment no education policy for children who are suffering with long COVID. There's not a lot of flexibility. We have families in our group who are very similar to us. Their children are not receiving any formal education because they can't physically get to the building and they can't cognitively concentrate on the work. Actually, I recall a post on our group recently, anonymously, where I think she's 9 or 10, and she is managing to get into the school building and she's falling asleep on her desk. I mean, that's not sustainable. And this is a thing that we can support with. We can say, look, if this is going to be harming her more than it's going to be benefiting her, so let's look into some kind of home education. Let's look into online flexible learning. Perhaps learning at the moment isn't what she needs. Perhaps she needs to recuperate and recover a bit more, because when you're feeling that unwell, you can't learn. Nothing's going to be taken in. So attendance for attendance sake is not helpful. So it's situations like that, and at the moment there's no policy, so everyone is trying to navigate in the dark. And it really depends on if you have a supportive school and a supportive local authority. It's hit and miss. we are very, very fortunate that Anna's school have been incredibly supportive. They have bent over backwards to try and help her. Local authority at the moment are dragging their feet a bit, but I'm hopeful that they'll come through. In other local authorities, families are not being supported, and they're being told that the attendance must increase, and that their child must go into school, and full stop. So there's no thought behind how this child is feeling unwell, or what accommodations they may need in the school. Rest breaks incorporated, maybe doing part-time school for a short time. Each family is fighting a battle.
Yeah, and that's something where it's great where you are getting good support from an individual school, but that's not that's not a widespread system of support. That sounds, yeah, and what you're going to end up with is people being left unsupported and falling through the gaps because it's individualist as an approach.
Yeah, absolutely. And there are families out there as well who perhaps need a little more support because they have no choice but to have two incomes for their family. So the child has to go to school. These families need help and support. That if the child is unwell, then they need to be helped to be able to rest. That family needs to be helped financially, and there really isn't anything in place at the moment. Nothing centralized. It's all quite messy, honestly. It needs to all be tightened up, pulled together, and policy put in place urgently. I feel like there is a complacency in Scotland at the moment, and I really feel like this should be looked at as an urgent priority. There are children being left behind, and it doesn't need to be that way.
Yeah, I think that's a challenge that is we're 2 years down the line. It's not impossible at this point to be saying when are we talking about implementing more systematic support, if I can be that blunt.
Yeah, no, there are times to be blunt, and I think this is one of them, because we're coming up to our 2-year coronaversary and looking back, I can't quite, if you told me 2 years ago that this is what I would be doing, I would not have believed it. How has my child gone from happy, healthy, doing well in school to chronically ill, disabled, using a wheelchair, and housebound most of the time? There is an urgency, because it's very simple. The more COVID infections we have, the more children are going to develop long COVID. We don't yet understand what impact reinfection is going to have on children and young people. We don't understand the impact and implication of that on long COVID development. I just think we're going to end up in a really difficult position where there's going to be so many children and teenagers with long COVID that they're going to be forced to have to do something. But really, we should have laid the groundwork already. We should be working hard right now to try and put education policy in place, get education and support for healthcare professionals so that they know how to support families. And at the moment, this hasn't been done.
So off the back of that, what would your key asks or recommendations be around meaningfully involving people with lived experience, so children, young people, their families with long COVID, who are living with long COVID, in terms of support and planning that support around long COVID? Because I think it's that insight that is needed.
Yeah, absolutely. This is something we are struggling with at the moment in particular. Since the very beginning of the pandemic, the narrative that children aren't affected, children only get a sniffle, children recover really well, that remains front and center. And we know this now not to be true. We know that this is not true, because yes, some children do thankfully recover really well and don't seem to have any ongoing issues. Brilliant. But there is a significant proportion of children who are now housebound. Some are bedbound. Some are extremely limited in what they can do every day. So there are children affected. And, I think the narrative needs to change. And I think that's the problem. We need urgent education, not just for healthcare professionals and not just for educators, but for the wider community. From what I am seeing local to me, is that people are still unaware that children can actually develop long COVID. And they're also unaware of what it looks like and how severe and life-limiting it can be. So it's almost like it remains a dirty secret. It's taboo. You don't talk about long COVID in children. Never mind Bruno. We do not talk about long COVID in children. We need to talk about long COVID in children and young people. We need to. This is urgent now. We're going to end up with a pandemic within a pandemic. So we need. What I would like to see is assistance from the Scottish government, who are trying. They are trying to help. But I think we need to go with a bit more urgency. I think we need to get a wider campaign in place so that the community is aware of what long COVID looks like, how to spot it, when to seek support and help from your healthcare provider. And then when you get to your healthcare provider, your GP, they need, or local nurse, they need to know what long COVID looks like, how to spot it, and so on and so on. And then if you get referred to pediatrics, the same applies. It's a big job, but we haven't started it yet. And 2 years into this pandemic, that really, to me, that's unacceptable. We need to move a lot faster. We need to have done this last year, quite honestly. And we've been shouting from the rooftops that this is happening. Please pay attention to it. Look at lived experience and learn from it and take it seriously. But, quite often we still feel like we're shouting into the void. It's very difficult to get engagement and interest in long COVID in young people. I think it's one of those things where if it's not happening to your family, then it's not happening at all, which is really sad. It can happen to anyone. We don't know which children will get sick, and we don't know which children will recover. So, you're only one more COVID infection away from long COVID. We don't know. We want to prevent as many children and young people from developing long COVID as we can. It's very difficult.
Yeah, and I think what you're describing there in terms of sort of a multi-stage campaign of information and education, sounds entirely sound. I mean, and that's before I open the can of worms that is, and are we including social care staff in this? And are we all the people who are going to come into contact with individuals needing support? Because this really, you read a lot so there's a really welcome statement in the National Care Service documentation around a sort of any door policy. So whoever is your first point of contact should be able to get you support. whether you come through a GP, whether you come through social care, whether you come through whatever. And for that to be meaningfully implemented with long COVID or anything else, you need a certain base level of education, knowledge and understanding, belief, if I can even use those terms in some cases, to see that happen. And that also involves public perception. So roll on the campaign.
It's funny you say that, because actually about 10 minutes before I came on this call with you, I had a call from one of the families who I'm supporting a bit more closely because they're having a really difficult time. And they'd just come back from an occupational therapy appointment. So they have occupational therapy and they have physiotherapy provided, which is fantastic. This did take 18 months to get, but they have the referral and they're having appointments. The physiotherapist is unsure of how to help the girl, teenager, she's 16. The physiotherapist doesn't know what to do and doesn't know how to help because the physiotherapist hasn't been given any support or training or education. And this morning, the reason she called me is because she saw the occupational therapist, who flat out bluntly just said, I don't think I have a role here. I can't help you. So I think that just really highlights what I was saying, is that, you know, you have a very, very sick child. You go to seek out these people who you think can maybe help. And then you come away from the appointment feeling absolutely defeated, abandoned. You don't know where to turn, what to do. Occupational therapy can help. They can help a lot. They can have a huge input to a child with long COVID. Also the physiotherapy too. It's just that they don't have the training yet to know how to help. With regards to social care, personally, for our family, I wasn't aware that social care could help us. No one had told me, no one had flagged it up. It was only in January this year that I was made aware that social care could potentially help. And the school were the ones to come forward and say that I think there's a role for social care here. I think you can get some support from them. Hadn't occurred to me, but then why would it? Essentially I am a parent looking after a poorly child. I don't know, I'm navigating the system like everybody else and learning as I go. So I am reliant, as are all the other families, are reliant on the experts to tell us where to go, what we can access and how we can access it. In our group of Scottish families, I'm not aware of any of them who have social care support. And I'm not aware of, let me think, also the child disability payment. It's just changed over, I think, hasn't it, to child disability payment. I believe there's only a very small number in the group right now who are actually applying for that. I myself only applied for it a month ago. Again, it's not something that I knew that we were entitled to. And that could be so useful for us. I mean, if we got child disability payment, I could pay for a private physiotherapist to come and do a home visit because Anna is too unwell to actually attend appointments. She cannot leave the house to attend appointments. Child disability payment would allow me to pay for somebody to come to her, and that could improve her quality of life. So, the fact that actually we as parents don't know what we can get, what support is out there, is really distressing. So when I found out about it, I then told everyone else about it. So now I believe they'll have a bit of an influx. So sorry about that, Social Security Scotland, but it's coming your way. We're still waiting for our to find out if we've been successful. I hope so. I don't see why we wouldn't be.
Yeah.
But
I also think that's a really interesting sort of series of observations around both information sharing, not just with the public, but the public who are also experiencing long COVID, living with long COVID, because there are parts of the system that until you have to navigate them, you don't know that they exist necessarily unless you have a first person connection.
Yeah, exactly.
And also the real value, I think, of that sort of interconnected approach, that if you can get, you know, good support from social care, you know, from social work professionals, from education, from allied health professionals, from medical professionals, that I was going to call it triumvirate, but I've listed four. That has the potential to have real significant impacts on people's quality of life, and that's presumably what everyone is aiming for. I mean, that's what every social worker I've met wants for their, it's sort of, that's, I picked social work there, but that could have applied to any one of those professions I listed, and the people seeking support. And it's about getting those systems connected.
And that's where we're falling down at the moment, is they're not connected. When the first time that I spoke to social work, who were extremely kind, very supportive, very proactive in saying, okay, well, let's look at what we can do, because we were the first family to come to them with a child with long COVID. So again, it's us having to go through this sort of, how can I put it? We're sort of finding out with them, with social services, how can they help? I don't know. I don't know. I'm relying on them to kind of figure it out. But, you know, I hope that, again, if we can pave the way, if we can be the first, that way we can help the families who follow.
Yeah.
But again, it's there's no joined up multidisciplinary team. We've been banging on about it for well over a year now, well over a year. It's just not happening. There's no connection, and it is complex and it is time consuming. But there are children who are housebound with families who don't know how to help them, don't know where to seek support, don't know what support is out there. And, you know, I guess that's we as a charity are trying to bridge that gap, but also we don't know where to go. So we're also relying, you know, on our own research. It's very messy. It needs tidied up. It's a big job, but again, you know, as I said, we should have started this a year ago, longer than that. And it's upsetting actually that we haven't done anything, or nothing has been done and still hasn't been done.
Yeah.
You know, why?
And I'm afraid I don't have answers to that one. Sorry. I'm conscious that I'm nearing the end of the time which I promised this would take up. So, and that you have, as listed, significant demands upon your time in many and varied ways. So I want to end with a final question we've used in a lot of Alliance Lives, and you can answer this as flippantly or as seriously as you like. There's no right or wrong. But what matters to you?
Are you trying to make me cry?
No. So feel free to crack a joke about football if you'd rather.
What matters to me? Me personally, all that matters to me is that my daughter can live a happy and healthy life. And if she can't live a healthy one, at least she can live a happy one. And at the moment, she's not happy at all. She's really depressed. She's isolated socially. She hasn't seen her friends properly in a year. She sits on the sofa every day. She's bored. She's fed up. She's really miserable. She wants to be outside. She wants to play. She wants to learn. She wants to do things. She wants to go places, and she can't. And yeah, for me, what I want is, if I can't get her back to how she was before COVID infection, I at least want her to be happy. What I want for the charity, I want inclusion. I want equality. I want to have to not fight every single day to be heard. I'm representing families in Scotland who are in crisis, and we shouldn't have to fight for help. We shouldn't have to fight to be listened to. I want the Scottish Government to have more of a sense of urgency. I want NHS Scotland to work with us, work alongside lived experience, so that they know how to design their long COVID services. At the moment, there's no inclusivity. So it makes me wonder, how can you design a long COVID support service for children and young people when you haven't actually spoken to those children and young people to find out what they need? That's what I want. I want everyone to be talking together, to be collaborating, to listen to the children, listen to the families, listen to what they're struggling with every single day, and listen to the battles that they are having. And then I want action, immediate action, because 2 years on, it's not good enough that we're still in this position.
I think that's
it makes me a bit cross. Can you tell?
I think that's both eloquently communicated and entirely understandable. Yeah, thank you for that. Those sort of final call to action. And I think that's really important. Thanks so much for that. And for listeners, you can find out more about Long COVID Kids' work via their website, which, correct me if I'm wrong, is www.longcovidkids.org. And links to the various support services that they offer can be found in the support section of their website. So I'll just end by saying thank you so much to Helen for joining me, and thanks for listening.
Thank you so much for having me.